So continuing with the gastrointestinal system. So in the system, many changes can be seen. Decrease salivary secretion, hence it can lead to dryness over the mouth, loss of teeth. So the person will not be able to take the food properly or not, lost interest in taking food. So loss of sense of smell and taste. So decrease the appetite as well as desire of food. Difficulty to chew food because of loose teeth, altered nutrition, digestion, and bowel function. All those things can be seen. Weakening of lower esophageal sphincter. The liver weight and size decreases along with age. So there is decrease in number of hepatic cell, and as a result of it, there is a diminished capacity for metabolism of drugs and hormones. Again, in gastrointestinal system changes also leads to decreased metabolism of drugs and hormones. So atrophy and decrease in the number of anterior taste buds can be seen. So as a result of that, there is changes in taste. So decline that is not evident in all persons. Okay, there will be always individual uniqueness or individual differences in that. So decline in number of gastric cells. So the amount of HCl, hydrochloric acid production will be less. So again, the metabolism will be altered. So pancreatic enzymes also will decrease. So as a result of that, metabolism of fat, carbohydrate, and protein also affected. The digestion will not occur properly, so the person will be having constipation. In extreme cases, it will convert to diarrhea and other chronic illnesses. So diminished gastric and pancreatic enzymes result in hindrance of the absorption of ferrous, calcium, and folic acid. So even though the person is, if the old age person is taking multivitamin, due to these problems, there will be lack of absorption of these vitamins. So again, vitamin deficiency and related health issues can be seen in old age. Hepatic blood flow, the size and weight decreases with age. So overall function, however, is preserved, but may be less efficient in the setting of drug overload. So sometimes the gastrointestinal system's overall function will be stable, but it will get altered when there is intake of drugs. So that is noted commonly. So decreased tone in stomach and intestine result in slower peristalsis, leads to constipation. Again, if the person is having constipation, that again leads to other problems, like the person will not be able to take food, lack of anorexia, sleeplessness, and other difficulties. So delayed gastric emptying, that is due to slower peristalsis. Decreased abdominal muscle strength. So decreased tone in bowel wall as well as anal sphincter. These all things can be seen in gastrointestinal system. Coming to the endocrine system. So endocrine, what may happen? Endocrine system is playing with the hormones. Okay, all the hormones will be decreased. How it will be? So decreased pancreatic insulin, decreased glucose tolerance. So when insulin is not producing, glucose, the amount of glucose the glucose will not be taken into the cell. So the person will feel fatigue. Sometimes the person can, while checking the blood, we can see hyperglycemia due to the decreased amount of insulin. Alteration in hormone production is the main thing. Decrease in all hormones. Decrease in estrogen, FSH, LH, progesterone, testosterone, renin-angiotensin erythropoietin, aldosterone. If aldosterone is being decreased sodium reabsorption. Antidiuretic hormone is being decreased. Diuresis is not being occurring. When the adrenocorticotropic hormones are being decreased, as well as cortisol, the person will not be face a stress response. So that can be affected. So decreased secretion of thymosin. So thymosin is produced from thymus gland. I hope you know it will be stimulate the production of immune cell called T cell. So decreased secretion of thymosin contributes to decreased immune system response. And coming to the final part, reproductive system. So changes can be seen in both male as well as female. So in female, menopause can begin at any time during 40s and early 50s. And gradual decline in the functioning of the ovaries and subsequent reduction in the production of estrogen. The walls of the vagina become thin and inelastic, and vaginal lubrication decreases. All these changes result in vaginal burning, pelvic aching, and irritability. So in some women, these changes result in avoidance of sexual intercourse. They will not be much interested to intercourse. So these symptoms are more likely to occur with frequent intercourse of only infrequent intercourse. So here it is telling that regular and more frequent sexual activity maybe prevent these signs and symptoms, or prevent these changes. So that means regular as well as frequent sexual activity is good for health. Changes seen in male: testosterone production decline. As a result of these hormonal changes, that is, erection takes place very slowly and it requires more genital stimulation to achieve erection. And while checking the volume of ejaculate, the amount will be decreases. The force of ejaculation also decreases. The testes become very small, as well as the penile size also will become small. So, but most men continue to produce viable sperm well in old age also. So that in that case, there will not be any change. So that is all about the physical changes, the biological changes which is occurring, or the changes which is occurring in old age. So question can come as biological aspects of old age. So you can write all those things, or physical changes which is happening in the body. You can write all those things. Otherwise, individually it can be asked. Changes in the cardiovascular system, changes in the endocrine system, likewise. So that is all about today's class. Thank you so much.